How you doing? I'm Isaiah Pittman the fourth, endocrinologist and founder slash CEO of HPW Center for Diabetes. And we're going to have a talk today about exactly what diabetes is to start off, how it affects different populations, majority populations, minority populations, and then move onward to how to treat diabetes effectively, given that there's been so many changes in diabetes management, diabetes research. Oftentimes that doesn't make its way into the primary care community until years later, given that I'm an endocrinologist and a scientist. I have a PhD in biochemistry, peptide chemistry. I'm a structure function guy, so that involves quite a bit of physics and chemistry, but I do see patients and made it my point to see patients as HPW Centers for Diabetes have sort of popped up across the country. We now have 9 locations within the Midwest and expanding out west and south as well. So let's start off with what is diabetes? Well, there's the classic definition of diabetes that's used by the majority of medicine, particularly primary care, and those who are in clinic all of the time, which is that diabetes means that your fasting glucose is greater than 125. Fasting meaning no food for 6 to 8 hours, typically overnight, but it really doesn't have to be overnight. It just has to be that span of not eating to be a fasting glucose. It also means that you have diabetes is diagnosed when you have a postprandial glucose, meaning after a meal, right? So if you have a postprandial glucose of 200 or greater 2 hours after a meal, then you're also diagnosed as being a diabetic classically. And then there's another definition where individuals get diagnosed as diabetes, and that is a random glucose, just spontaneous glucose that is 200 or greater, right? So it doesn't have to be after that 2 hours, it can be random, and that will also get you the definition or diagnosis of diabetes. Now that's a very classic sort of, more recent definition that clinicians use. Not really what we use in the laboratory. I had the fortune of being in 2 labs, one that was nominated for the Nobel Prize and another that actually won the Nobel Prize, and being involved with those individuals. And the definition of diabetes that I learned is that diabetes is a syndrome of disorders of which a common manifestation is abnormal glucose metabolism. Yep, a syndrome of disorders, meaning multiple things, of which a common manifestation is abnormal glucose/sugar metabolism. Meaning you don't have to have a glucose of this or that, because that definition, by the way, has changed, and I won't go over the history of clinical medicine for diabetes, but the definition of fasting glucose has changed during my own lifetime 3 times, right? So that definition changes, but the definition that I just gave you has stood the test of time. When someone is abnormally metabolizing sugar, they are diabetic, right? And now there are multiple types of diabetes. I'll just mention the 2 types. Type 1 diabetics are folks that have an autoimmune disorder where they make proteins that attack their own cells in the pancreas that make insulin. Their body itself, which is why it's called autoimmune, destroys those cells called beta cells that make insulin, and henceforth they develop diabetes pretty rapid in onset. They're usually kids. By kids, I've got some gray hair now, right? So by kids, I'm meaning 23 and under, right? So they're usually younger individuals, and it does occur in families, but not as linked to being in families as the more well-known type 2 diabetes, which is a syndrome of insulin resistance. The body makes insulin, but it can't efficiently use that insulin. That's the more common, much more common form of diabetes. It used to be called adult onset diabetes, but that doesn't really define what's happening. So the name was just changed to type 2 diabetes, right? So your type 2 diabetics make insulin, but they can't efficiently use that insulin, right? So we call them insulin resistant. And yes, being overweight is associated with insulin resistance, but all type 2 insulin resistant diabetics are not overweight. In fact, even though it's less than 10%, but there's a substantial amount of them that are normal weight, and they just have a genetic predisposition to their body's insulin not working efficiently. But you are correct if you're thinking, well, the majority of them are overweight. That is absolutely true. The majority are overweight and obese, and It is that type of diabetes which makes up more than 90% of diabetics in the country. It is type 2 diabetes that has made diabetes not only the most common metabolic disorder in the country, but it has also made diabetes the most costly healthcare illness in the country. In fact, 25% of the entire healthcare budget is spent on diabetes and diabetes related complications, right? i.e., diabetes takes up 25 cents on the dollar. Right now, before people get all excited and say, oh, that's probably due to the expensive cost of the meds, and you're wrong. It is not due to the expensive cost of the meds, and it certainly is not due to doctor's visits. The medicines themselves, including supplies, make up less than 20% of that cost. Physicians' visits make up less than 10% of that cost. So where is the money going? Because diabetes is the number one associated factor with heart disease, even though people call it metabolic syndrome. From a scientific standpoint, it's diabetes, which means it contributes greatly to heart disease, which is the number one cause of death. Diabetes is the number one cause of kidney failure in the country. It is the number one cause of blindness in the country for people under the age of 65. And it is the number one cause of individuals getting lower extremity amputations outside of a motor vehicle accident of some sort, right? So, but for illnesses, it's the number one cause of amputations. Now, it's the number two cause of strokes, but you put all of that together in hospital stays, emergency room visits, long-term care facilities, and of course, dialysis centers, which pop up like McDonald's in particular neighborhoods, almost, as common in some neighborhoods, especially when we talk about minority communities, and we'll get to that. So the reality of the matter is diabetes is prevalent. It is affecting, by CDC standards, just over 40 million, or right around 40 million people in the population. By actual endocrine and diabetes research standards, it is affecting more than a third, or roughly 40% of the US population. That's a big gap of people that don't know it. There's about 98 million people that are designated as being pre-diabetic, a term that we do not really use when you know the definition of diabetes and when you do diabetes research, but it is commonly used in primary care. We consider pre-diabetics to be simply mild diabetics, and they need to be informed that they have a cardiovascular risk that is elevated. They have a risk of kidney disease, eye disease, and neuropathy. Yes, diabetes is also the number one cause of peripheral nerve damage, meaning distant limb nerve damage. It's the number one cause, right? So how does this affect minority communities? Well, we already know, minority communities, African American and certainly Latino as well, these communities have a higher percentage of individuals that are overweight and obese. In fact, when we look at the female population, or the women in African American communities, we're talking about roughly 80% of African American women are overweight and obese. And the ones who are not are typically under the age of 30, right? So plays a huge role in the prevalence of diabetes. Now, it would be great if it played an even huger role in the early diagnosis of diabetes, but that's not the case, which is one of the reasons that the detriment of kidney failure and the like, heart attacks, strokes, occur in African American communities. It's not just because the prevalence of diabetes is higher, or I should say incidence of diabetes is higher. It is because of the fact that the diagnosis is delayed, oftentimes due to not going to regular clinic follow-ups, oftentimes due to denial. In fact, there is a wonderful phrase we use in the diabetes community called deniabetes. And there is a lot of deniabetes in minority communities, both African American and Latino, which is why you again see dialysis centers popping up everywhere, because as individuals deny that they are diabetic, the kidneys are getting damaged, the vessels are getting damaged, and we end up with strokes and heart attacks and of course kidney failure, right? And now, how do we treat diabetes? Well, the first treatment of diabetes, as I was taught a long time ago, which is not utilized typically in the United States, but certainly is utilized at HPW Center for Diabetes, is early diagnosis. It is much easier to maintain control of diabetes than it is to obtain control of diabetes. Meaning the earlier that you can diagnose someone, and that critical value that you've all potentially heard or possibly heard called the hemoglobin A1C, which measures the average glucose in a 3 to 4 month period, the sooner you can diagnose someone as being diabetic, the more likely you are to be able to maintain that control, because they're already not be poorly controlled. Once you lose control of diabetes because their individuals are diagnosed later, not only do you run the risk of likely complications such as the diabetic neuropathy in the hands or feet, heart disease, kidney disease, and eye disease, now you have to try and aggressively control the diabetes. And yes, the molecule that won the Nobel Prize for such is insulin, right? But most individuals today do not require insulin, right? That is something that whether when we're talking about type 2 diabetics, which I've been discussing primarily, yeah, that's most of those individuals, less than 15% actually really need insulin. Now we know about 30% of them are on insulin or so, 30% or more. But that's because, again, the majority of diabetics in the country are treated by primary care doctors, and primary care doctors are not as familiar with two things: early diagnosis and more advanced treatments. And so insulin is used much more frequently than it should be in the general type 2 diabetic population. Now, type 1 diabetics, diagnosed as kids, diagnosed early on, they need insulin, right? Absence of insulin in any mammalian species, even fish for that matter, is incompatible with life. But when you're a type 1 diabetic, your body simply is not making insulin. And so since absence of insulin is incompatible with life, they all need insulin, period. There are no oral options from that standpoint for a type 1 diabetic to control them. But for type 2 diabetics, which make up well over 90%, there are many options that don't involve insulin, and really should not involve insulin for the majority of them, especially if diagnosed appropriately. So that gives you the long and short of it when it comes to diabetes. Again, I'm Isaiah Pittman IV. I'm an MD as well as a PhD in biochemistry, specializing in endocrinology, CEO and founder of HPW Center for Diabetes with locations in Illinois as well as Indiana and Ohio, expanding also to down south to New Orleans as well as Las Vegas, and shortly international. We can be reached at a central number, which is 812-235-8496. That's 812-235-8496. You can reach us, make an appointment. We are a private institute, and you don't need a physician's referral to see us. And so, we'd love to see you there, and you guys can come and we can discuss risk based upon family, risk based upon ethnicity, risk based upon dietary habits and exercise habits. So nice talking with you guys, and appreciate you listening.